Aloha everyone! My name is Mary Ann Rose and I will be presenting non-communicable and communicable diseases. Non-communicable or non-infectious diseases are diseases that cannot be transmitted from infected host to susceptible host. Delineating the causes of non-communicable diseases is often more difficult because several or even many factors may contribute to the development of a given non-communicable health condition. These contributing factors may be genetic, environmental, or behavioral in nature. For this reason, many non-communicable health conditions are called multi-causation diseases. An example of which is heart disease. Genetics, environmental factors such as stress, and behavioral choices such as poor diet and lack of exercise can all contribute to heart disease. Examples of non-communicable diseases. From acute diseases: appendicitis, poisoning, injury due to motor vehicle crash, fire, gunshot, etc. From chronic diseases: diabetes, coronary heart disease, osteoarthritis, cirrhosis of the liver due to alcoholism. Non-communicable diseases are a global challenge. They are the leading cause of death in all world regions other than Sub-Saharan Africa, with 80% of deaths in low-income and middle-income countries. Cardiovascular disease. A systematic review of evidence from population-based research reported moderate to strong prospective associations between depression, 15/22 studies, anxiety, 4 of 8 studies, and coronary heart disease. The outcomes studied included angina and non-fatal and fatal myocardial infarction. Population-based cohort studies also show that depression is an independent risk factor for non-fatal and fatal stroke. Follow-up periods in many of these studies were longer than 10 years, which renders depression included by preclinical cardiovascular disease an unlikely explanation. The effects were largely independent of risk factors for cardiovascular disease, since most of the cited studies comprehensively controlled for such factors. Diabetes. Meta-analyses suggest that psychological interventions in type 1 diabetes, in children only, and type 2 diabetes improve diabetic control. Participants in these trials were generally selected on the basis of risk factors for diabetes complications, such as poor glycemic control, obesity, or inactivity, rather than depression. A large trial in 9 U.S. primary care clinics reported that evidence-based collaborative depression treatment consisting of pharmacotherapy, problem-solving treatment, or both in combination. For patients with diabetes and depression did not produce better effects than usual primary care on either glycemic control or diabetic self-care, despite significant effects on depression outcomes. Let's move on to the communicable diseases. A communicable or infectious disease is a disease for which biological agents or their products are the cause and that is transmissible from one individual to another. The disease process begins when the agent is able to enter and grow or reproduce within the body of the host. The establishment of a communicable disease agent in a host organism is called an infection. Examples of communicable diseases. From acute diseases: common cold, pneumonia, mumps, measles, pertussis, typhoid fever, cholera, and COVID-19. From chronic diseases: AIDS, Lyme disease, tuberculosis, syphilis, rheumatic fever following streptococcal infections, hepatitis B. Communicable diseases continue to cause substantial death and disability in low-income and middle-income countries. HIV or AIDS, which causes 8.2% of all years of life lost, collectively account for nearly 13% of premature mortality and 39% of that attributable to communicable diseases. In 2004, about 34 million people were living with AIDS and over 3 million died of the disease. HIV or AIDS. Very few studies have investigated mental disorder as a predictor for HIV transmission, especially since the advent of highly active antiretroviral therapy, or HAART, H-A-A-R-T. One study of 168 HIV-infected men with resistance to antiretroviral drugs showed a high rate of high-risk sexual behavior, such as unprotected anal or vaginal intercourse with an HIV, uninfected, or status unknown partner. These investigators reported strong evidence that depression, younger age, and sildenafil use predicted transmission, and moderate evidence that frequent alcohol use did so. Tuberculosis. People with mental and substance use disorders might be at increased risk of contracting tuberculosis, although few studies have investigated this topic. A case registry study from Nagasaki suggested that the incidence of tuberculosis in patients with schizophrenia was high. Similarly, high infection rates were recorded in people with serious mental illness in a psychiatric day program in New York. Occasional reports of outbreaks in inpatients suggest that institutionalization might contribute to risk of tuberculosis. A U.S. population-based case control study reported that heavy drinkers had twice the risk of tuberculosis infection of non-drinkers. Malaria. No studies have investigated the possibility that mental disorders may increase susceptibility for malaria. Possible mechanisms could include effects on immunity and on adherence to effective preventive measures. Severe falciparum malaria is associated with self-limiting psychiatric disorders, including depression, schizophrenic, and manic syndromes. anxiety attacks, and confusional episodes. Treatment, especially with chloroquine, might be an associated factor. I just researched the word chloroquine. Chloroquine belongs to a group of medicines known as antimalarials. It works by preventing or treating malaria, a red blood cell infection transmitted by the bite of a mosquito. Chloroquine may treat malaria and lupus. And that's all. Thank you for listening. Bye.